let's just take a short look at some of the effects of radiation, a couple ways that you can detect it, a couple things that it's used to treat. All of these topics by themselves are really large topics. We're just kind of getting a quick overview. So radiation can come from natural sources and from man-made sources. There's a certain amount of radiation that is just out in the world that they call background radiation. It's nothing that we necessarily worry about or even think about. So there are some radiations we can control in terms of testing and things like that, but background radiation, it's pretty hard to control. And if you compare, and they might have in your book a scale, like the background radiation is just a teeny tiny piece of your overall lifetime radiation exposure. But anyway, there's lots of sources of radiation. And why we worry is that nuclear radiation can penetrate living objects and disrupt their biological systems. So it can disrupt, ionize molecules, which then can create reactions that you don't necessarily want to happen. It can cause cell damage, cell death, and this disruption can lead to things like cancer. Cells that undergo rapid division are most sensitive to radiation, and maybe some of you in biology have talked about the different cells that divide rapidly. I know it's like things in your intestines for sure. I'm pretty sure skin. I think your reproductive organs. I think these are all things that have cells that undergo rapid division. And so they would be more sensitive to radiation exposure. The other thing that can often be sensitive to radiation exposure is cancer cells themselves, because if they are dividing rapidly, they would fall into this same category. So we do think about radioactivity at times, and it's good too. It's not to worry about the minute background radiation, but to be thoughtful about the tests that we might be undergoing and those types of things. Now, how they detect and measure it. So radioactivity you cannot detect with human senses, so we can't see, smell, taste, feel it. So they have other ways to detect it. So there's something called a Geiger counter. I always associate this with old movies where someone's in some type of a mine or something, and they have this instrument and it goes beep, 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 and then if it gets closer to something radioactive, it will beep faster. So these little devices are filled with argon gas, and the radioactivity ionizes the gas, and when it's ionized, then it goes through the machine creating that beep. So they have it electrically, so it will beep. So that's one way that they detect radiation. If you work in a medical field or in another field that there's a possibility of radiation exposure, you might use a radiation badge or a radiation ring, and this has something that will detect, usually ionizes as well when it's exposed to radiation. They test it on a periodic basis and make sure you're not being exposed to harmful levels. Radiation is what they call a cumulative exposure. So in your lifetime, if you have a short period of time where you were exposed to more radiation, then if you go through a time where you're exposed to less radiation, it can kind of balance itself out. So I remember I had a student who's, I think it was their uncle, worked in a Florida nuclear power plant, and his badge was too high. So the student was sharing that his uncle had to be away from work for 6 months, but it was paid, but paid 6 months off because of the exposure that he had had. So you can see the different units, and I'm not going to have you, they're right here. I'm just mentioning them in case you come across them in a problem, because I do have a conversion problem, but it doesn't require you to know what the units mean. But there's all sorts of units for measuring radioactivity. You can see a becquerel, a curie, named after Madame Curie, and then there's millicuries and microcuries. So those are all units that indicate radioactivity. They also have where they measure how much of the radioactivity is absorbed. And so they have things like the RAD, which means radiation absorbed dose, the REM, radiation equivalent for man, a Gray or a Sievert. So these are all units associated with radioactivity. I'm not asking you to memorize any of them. Again, I'm giving them to you here. So if you see a problem with one of these things, you'll know it's a unit. And then if I'm asking the question, it has to do with a unit conversion. Now, radioisotopes are used both in diagnosis and treatment, and perhaps you've had to use a radioisotope in some type of diagnosis, but they will either inject it or you will ingest it, and then they will put you in some type of machine that they would scan it, and through the radioactive isotopes travel through your body just like normal isotopes would, but they will give off radioactivity, and so the machine they put you in can detect the radioactivity, and you get images of your organs. It is pretty cool, and in your textbook, they do have some images that were taken using radioisotopes. So it's worth looking into. I'm not going to ask you about any of those tests. Just know that sometimes we can ingest or inject these radioisotopes to image our organs. Here's some radioisotopes that are used in treatment. So they use it in diagnosing problems. They use it in treating problems. You don't have to memorize any of these. I always just find it interesting, though, just to see all the different things that they can use to treat different problems. And this picture from your textbook just gives you an idea about some of the radioactive isotopes that are used, and you do not have to memorize any of those or what they're used for. It's really, again, some context. And then the other thing I want to mention is positron emission, or PET scans. So this also does use radioisotopes that emit positrons. I know my brother-in-law had colon cancer, and after so many months of treatment, they would do PET scans so they could see if the treatment was working. And you can see here, they'd use it for so many things outside of cancer: coronary artery disease, Alzheimer's, and track the progress of cancer. That's what they used it for, my brother-in-law. So PET scans are non-invasive, but they can monitor things because it gives you a picture inside of your body. Now, I do want to mention a couple things. X-rays are radiation that does not come from radioactivity. So, X-rays have to do with the electrons outside of the nucleus. Whoops, I didn't mean I meant radioactivity, sorry. I was talking and writing radioactivity. So they're not nuclear in nature, X-rays aren't. But radiation, it does have some of the similar effects on our cells because it is radiation. So a large exposure could cause trouble. But I was talking to my dental hygienist, and she said since she's been working, the X-rays that they use at their office, it's a lot lower dose than it used to be. So it's actually safer than it was, 10, 15, 20 years ago. Getting an X-ray at the dentist you were exposed to more radiation than you are now. So with technology and some digital things, X-rays are safer because they don't use as much radiation. The other thing, there's other tests that are don't use radioactivity or radiation. MRIs Those do not use radiation. Ultrasounds, those do not have radiation. So not all medical imaging is radiation or radioactivity, but some of them are. And just because you hear radiation doesn't mean that is radioactivity. If I'm not mistaken, I think also CAT scans are radiation, but not radioactivity. I think CAT scans are more along the line of X-rays. And I don't ask that you memorize that. I just feel like I'm mentioning PET scans, and I just want you to, and you probably know more about it than I do, just be aware that not all medical imaging tests involve radioactivity or radiation.